the first question, I like to invite, I mean, the panelists are here, but just I want to introduce them in a short way. Uluk is online, it was in previous session. Galina Sergienko, right, okay. Head of the team Behavioral Health and Telehealth Alliance, from Alliance for Public Health in Ukraine. Pavel Kisaru, right, okay. Association, president of the Association of Students and Residents in Medicine here in Moldova. Dr. Galina Lesko, right? Youth-friendly clinic Moldova, you hear from her a little bit earlier. Dr. Angela Capcela, from representing UNICEF Moldova. Dr. Gaukar, right? From Kazakhstan National Medical University. Congratulations for your first presentation. It was amazing with inspiring data and thoughts for our work. I want to go directly to the question for Pavel. He's a student in the Faculty of Medicine in Moldova in the 5th year of the study. Also, I mentioned he's the president of the association. The question for you is, from a student's and young healthcare professionals' perspective, what barriers do you see in HIV education and preventing among peers, and how can we strengthen support for youth-led initiatives within medical institutions?
Thank you so much, Andy, for introduction. I'm glad to be here with you. And, bună ziua, stimați invitați, dragi colegi.
Dear colleagues, I welcome you. Today we are discussing the prevention of HIV infection, and I will start with a topic of great importance, and namely the involvement of youth in preventing or combating HIV infection. Youth are a force. Youth are this creative force that has potential and desire to change something. Youth has potential to change the way we perceive and combat this infection, but youth also need support. They need information and they need active involvement in this field. First of all, I would say that a huge issue in involving youth in combating HIV is disinformation and the phenomenon of infodemia that we are facing with now, especially the younger generation. It appears in social networks, in the environments we live, in the environments we study and work. And I would say that there is another challenge among youth from the medical sphere, especially the youth that have just started studying medicine. Not always they know some specific aspects. First of all, education and awareness raising are the key to success. Thus, youth has to be informed on the risks and prevention methods, how to combat, how to fight HIV infection. This is why it's more than welcome to organize various awareness raising and information campaigns, various sexual education sessions that have to be adapted to the real needs of youth. And again, they have to be made as accessible as possible. Also, these programs and sessions have to promote an open dialogue between youth. As a result, these educational sessions can be organized in schools. The awareness-raising campaigns, information campaigns can be organized at the level of population, and youth will become more aware. They will pay more attention to protection and to regular testing against HIV infection. Quite often, youth feels some barriers and they don't feel comfortable to speak about HIV and its transmission in their own circles, in family, discussing with their friends. So they cannot quite openly speak about HIV infection and about STDs in general. The goal of the information campaigns and the goal of the sexual education programs is to destroy these barriers in order to create a safe environment where they could openly speak about this topic, provide more safe information. I also see another challenge. A lot of young people know how to correctly how HIV infection is actually transmitted. They tend to think that HIV is also transmitted via air, and they are afraid of staying in the nearby of the infected youth. But we have to encourage the younger generation to support the youth that suffers from this infection. Thank you so much for your attention.
I'm happy to be among you, and thank you very much for the invitation. So I'm starting right away. I fully agree and support the previous speaker that the world is overloaded with information, unverified information of various content. So our primary task was how to draw attention to this unpopular topic as HIV. So what is our way, how we can do it? I would like to share the Ukrainian experience and share you information about our drugstore project, and you can access this QR code and you will find all the services. They're available in Russian, Ukrainian, and English. So if you follow this link, I assure you, you will like it. Drugstore is an educational and preventive project. We've been working in Ukraine since 2018, and we are doing prevention of HIV and harm reduction from substances and the sexual and mental health of young people. Our project is based on smart pleasure. So instead of imposing some moral norms, we engage young people in friendly conversations and offer them verified information on the topics above. Our target audience are the young people who show risky behaviors and can not identify themselves with some risky groups such as consumers of psychoactive substances or sex workers or LGBTQ plus people. On a separate note, I would like to draw your attention that we work with consumers of psychoactive substances, unlike drug users, including those who consume new psychoactive substances. So we do a lot of research. From 2018 we have been doing it regularly, and we see that the young people who consume psychoactive substances, they are more prone to risky behaviors, risky sexual behaviors, and they are also in a risk group which can easily transit towards injection drug use. So working in this domain, we managed to build a trustworthy and confidential environment which enables these young people to discuss with us anything on their heart. We base our services on the needs of the target audience, so we offer our services only to where we find our target audience. So these include free anonymous consultancy. So again, you can follow the link and watch this, and you can even access it via an application. So these are consultancies and services of infectionists, of psychologists, of specialists in psychoactive substances. We added a shrink and even a sexologist recently. So we just try to address all the needs and interests of our target audience. We also publish a lot of content on our website and in social networks. As you can see, we are present practically in all modern social networks, including Instagram, TikTok, YouTube, and so on. Also, we also organize lectures and trainings, including they're available online. We support festivals of electronic music. So this is an important part of our activities. We disseminate lubricants and preservatives, And we also disseminate harm reduction supplies like tests and so on. We also have covered surveyed of the 15,000 people, and we have interesting results. We also have data on overdosing. An important topic which was not yet mentioned by anybody else before, and this is visual communication. Besides giving an adolescent something which is important for them, we wrap it in a attractive package. So we managed to promote the culture of self-care and make it popular among the young people. Participants of our program, they want to have this content or some merch, some ads or commercials for themselves. So after they get this content, they produce very cool and fashionable and trendy so they receive this merch, and as I said, we give them very trendy supplies, accessories, and so on, and they create very interesting things for their audiences online. So actually, we have multitude of posts and reposts. You can look up online, including posts with the results of their HIV tests. So HIV testing becomes a trendy thing. Include we provide services to people based on their needs and priorities, and visual communication, because this is what we must learn to do, how to attract attention. Thank you.
It is working? Okay. Thank you very much, Galina, for all the information you shared, especially for the app as a best practice for young people. Now I want to invite the only person that we have online, Luke, in our panel. Luke is working as a coordinator for Euro-Asian Coalition for Health, Rights, Gender and Sexual Diversity. He's from Kyrgyzstan. Luke, the question for you is, given your experience in sexual and reproductive health and rights, what strategies would you suggest to integrate HIV prevention more seamlessly into broader sexual and reproductive health and rights program for young people, making safe practices like PrEP appealing and relevant for young people? Thank you.
Thank you so much. Hello, Green. It's me. I hope you are not tired of listening me. So, happy to see Andy, you as well. We know Andy with each other like since 2018. I've been involved in SRHR. I'm hearing echo. Do you have the same thing?
We don't hear echo here.
Okay, I think it's only in my end. So, I've been in SRHR field since 12 years old, and I'm always asking myself, like, what is now, what should we do, what I should do to engage more young people, more adolescents, what will really attract them, what will make them to want to come to the counseling, for example, or to get the services, or to get any like safe sex practices, etc. And it's always the answer is as simple: make it safe, make it inclusive, and make it as much sexy as you can. What I mean by sexy is not the term of like demonizing the sexy term, but making trendy, like setting a trend for sexual health, setting a trend for health initiative. And I think when we talk about HIV prevention, we talk for a long time HIV as a separate topic from sexual and reproductive health and rights. But in reality, we should do it very integrated and intersectional. What we can offer, for example, during the checks like medical checkups during the school, for example, or what we can talk and what we can do in our programs. In most of the post-Soviet Union countries, like there is a trend like talking about HIV and AIDS when it's 1st December. This old style in schools, usually they do this like old style. You need to draw something that AIDS is an epidemic, AIDS is a new how it called like new danger of this 21st century, etc., etc. So we see this common approaches on like making promotion of prevention of HIV. So the best thing is to, when the previous speaker, Dr. Galina, was talking about how they build youth-centered clinic, how they build youth-friendly services, ask the young people where they will go to get an information about anything related, first sex, relationship, or gender-based violence, or if they are victims of sexting, victim of the bullying, victim of the harassment, etc. This is very key and important to always to listen them up, to bring to the table, to bring them among us in this event panel. And from the academia perspective, even in academia, for example, look at the percentage of young researchers who are involved in doing some research which is focused not only youth topics, because youth can do more than only talking about young people, right? And I think another very good perspective that SRHR services integrated to the state services through, I don't know, healthcare coverage, and make it as much as accessible as we can. For example, getting a PrEP, not only going to the AIDS center, for example, giving a passport, giving all your information when you already have a fear. Imagine a adolescent like 16, 17 years old who had consent sex for the first time and have a lot of fears in the mind. Oh my God, my parents will punish me. Oh my God, I will be pregnant, or for example, getting STIs, or getting HIV, or I will be bullied, or I will be, I don't know. It can be different cases. And in all of these fears we are having ahead of adolescents, we are giving additional fears as a system. For example, as a medical doctors who are very tough in young people, like you, young person, came to ask about sex, how dare you are, etc., right? This kind of all approaches, demonizing sex, demonizing sexual health, demonizing HIV should also end. We should use a positive approach. Positive approach, I mean, not encouraging to have sex, because some of you could say, oh, look at them, they are encouraging our young people in Moldova to have sex, etc. No, they already know about what is sex from internet, from their society, etc. But our role to create a space, an environment where they can trust it and where they can come and ask, for example, parents, schools, medical institutions, or communities, or like NGOs, rather going to the streets or internet and asking unreliable and not justified, not evidence-based information. So let's keep track and conversation on this, and not forget about young people and adolescents involvement in HIV prevention only limited with today, but also go beyond of this. Thank you so much.
Thank you, Uluk, for your inspiring information and recommendation how to involve young people. It's okay, the mic? Okay. I need to introduce the other panelist, Dr. Galina Lesko. She spoke previously about youth clinics in Moldova. At personal level, I was inspired for the work you are doing here in Moldova. The question for you, in your experience with youth health services, what are the key factors that make clinics truly youth-friendly, and how can we ensure these clinics effectively serve the most vulnerable youth groups in the population?
Previously, in my presentation, I spoke about the characteristics or the steps that make our services be adapted to the needs of adolescents. Probably the key word is that the services should be adapted to the real needs of adolescents, of our beneficiaries, and not to the needs that are invented by us adults. The needs, this is why the needs have to be permanently assessed, consulted, and taken into account while organizing the services. Probably another key word is a real partnership between services and our beneficiaries. When the beneficiaries from different groups come. Quite recently, we had consultations with our partners who work with the beneficiaries, and they know the needs of various vulnerable groups, and these consultations have to be organized on a regular basis. So we have a volunteering program within our youth clinics, and they assure this involvement. What's interesting, the majority of volunteers are the former beneficiaries who further on promote the cases. Recently, our volunteer quite actively worked with us after a suicidal attempt, and now she works within peer-to-peer, providing support within a program proposed by UNICEF. So this is just one result. And probably the focus should be on adolescents not as an object but as a subject who has to be taken into account together with her needs and the capacity of decision making, so that they have a much healthier and safer life. Maybe I am speaking in technical words. I spoke less about this positive attitude, but this all derives from the basic strategy that can be heard, and probably the beneficiaries themselves would speak much better than me.
Thank you very much again. I want to go with Dr. Angela Capcela from representing UNICEF here in Moldova. How can multisectoral partnership can be leveraged to strengthen adolescent HIV-related health services in Moldova, especially to integrate HIV support into existing health and education framework? The education framework was mentioned before as one of the most important part of informing and educating young people.
Thank you so much for your question. This is quite an important question, and at different stages it has various answers.
So currently the Ministry of Health stipulates that the answer to HIV infection is totally integrated in the healthcare system, but we know that the current actual situation and what is written in the standard systems is a little bit different. And this relates not only to the existing standards in the pre-birth giving service when the mother is infected, or in the child health care, or in the care to the parents, and also in the care during the school time, where the school should also give some support. And afterwards, building a trust relationship between the parent and the child, and between the child and existing services. Actually, these are several important points. We are speaking about standards, we are speaking about human resources. Are they educated? Do they have enough training? Is it necessary to revise maybe how the medical staff is trained? For sure, we know that there are a lot of question marks, not only to the medical staff, but also to the staff of the education system. At what extent the questions relating to HIV infection and its prevention is clear to the school teachers, and how do we empower the teachers to bring this information to children? How the interaction between the healthcare system and educational system take place? How do we invite the experts in this topic? It is very important to establish this connection between such services like the youth-friendly health services and the schools, because we do have such examples. But unfortunately, there is no system to ensure that this connection is present in all schools. Unfortunately, especially the rural schools don't have much access to such connections. That is why it is very important to establish this mobile team that goes to the rural schools to reach and to help both the school and the teenagers from that school to know and to find some answers to their questions, and at the same time to receive assistance at the highest level. Another important factor besides the human resources are the money. So we ask ourselves, do we have enough money to ensure such a service package? And how should we provide this service package so that it is efficient and corresponds to the challenges from our country, especially in those rural areas who are far from the main cities? That's why establishing the clear costs of the medical services like prevention for teenagers and establishing the costs including in this intersectoral relation with the educational system is very important, because this will afterwards bring the specific funds for the human resources and the services will be provided. In my opinion, this remains a very important problem, namely this cross-sectoral collaboration. A separate topic is the development of a curriculum and mandatory curriculum in the schools and extra school curriculum, those components. In this case, it is also very important to have this cross-sectoral collaboration and to invite the professionals from the healthcare system.
Thank you very much for your great discussion. I see and I believe that in the region we have similar barriers in terms of educational framework and integrating into the educational framework. Last but not least, Dr. Gaukar Merginova, sorry for misspelling, from Kazakhstan National Medical University. You spoke a little bit earlier about JASPARC study, and my question is related to this study. What are the primary challenges and success in using digital intervention to reduce HIV stigma among young people, and what lesson can be applied at our region, I mean EECA region? Thank you.
Thank you very much. So when we organized study, we first were concerned that the topic itself is not very popular among youth and adolescents. Second, we were not sure if actually our youth could understand and deliver good messages about HIV stigma, because our topic was even more complicated. It was about stigma against HIV testing. So, and another thing, we were not sure how to provide self-testing kits for our young adolescents or adolescents and young adults, because HIV testing is available mostly in network of AIDS centers in Kazakhstan. I think this is the similar approach in all post-Soviet Union countries. But when we started working, we understood first that stigma is a complicated concept, but our youth, our adolescents and young adults, they managed to look through online sources. They managed to understand this concept, but we had to provide additional information on our website when we organized this contest, because we actually, when we started receiving works, we realized that they actually can create content that is actually stigmatizing itself. we had like very high quality video materials that actually increase stigma. There was some examples that two people having wounds meet each other and are infected by with HIV. So we had to provide feedback, explain, and kind of propose them to resubmit their work. So that's why we had to create additional resources on our website and describe, what is stigmatizing language, because some of them used stigmatizing language to create content. That was like the biggest challenge that we faced when we conducted this crowdsourcing contest, because the concept of stigma, HIV stigma, is very complex. Another thing is to market to promote the contest among youth in Kazakhstan. We realized that it is really expensive thing to do social marketing, like to promote the contest, but then we invited volunteers to work on that, and we realized that this is huge potential, great potential within the community, youth community. They created such an attractive visual materials for free, because they based on their own, creativity. They used their own language, and they created very attractive materials to promote this crowdsourcing contest in Kazakhstan. Another thing, we realized that actually it is really important to provide this opportunity to order self-test kit without going to any other places. So then, majority of our participants who had the opportunity to order self-test kits, we actually provided them opportunity to go to the NGO that works with adolescents and young adults, and to go to AIDS center, to go to polyclinics, and they prefer to order self-test kits. So they need this confidentiality and kind of independence to order these self-test kits without contacting with intermediate agency or agent. So these are the main challenges and opportunities. I think the biggest opportunity lies within this population. They have a huge potential to participate and to create content that is actually relevant for this population. And they can do that. And we probably can involve them more in this job and kind of invite volunteers to participate in this kind of research. Thank you.
Thank you very much for valuable insights that you shared with us, and how we can go from the data that this study has provided to more regional context. I love the approach from bottom to top. In this case, hearing young people what are their needs to go, promoting new strategies, new policies, and new approaches at national and regional level. So now is the time for question and answering, and I hope that our panel have inspired us and you all together for amazing work that they are doing. So now I open the floor for question and answering from your side.
My name is Tatiana Kiryak. I'm a doctor infectionist doctor from Yalovin District Healthcare Center. And I would like to ask, previously, because I graduated the University of Medicine in 1986. So, in the past times, in the medical institutions, there were some mandatory tests for investigations, for syphilis investigations. And I would like to ask why, from the legal point of view, the HIV testing would be a discrimination. Because the intentions of the state or medical workers, of the government and medical workers, have to prevent, to reveal this infection at an early stage and to initiate the treatment in time, not when this infection is in a terminal stage. And maybe we should disclose this discrimination in a different way, because not everything is done to discriminate somebody. When, for example, there were the COVID tests, the isolation was not discrimination at that time. So maybe we should explain to the people that the HIV tests are not discriminatory in any way. And it would be good to have like these vending machines, like where we do the electronic payments, for example. It would be good to have such machines with fast kits, test kits for HIV, so people could buy one confidentially and do the test. And if they would have a question afterwards and would like to be anonymous, they could call a hotline, for example. But I don't think that this is an issue of discrimination. Every person, when they are sick, they feel discriminated, they feel unhappy and think that everybody discriminates them. But I think we understand the stigma in a wrong way. That's my opinion, and I think we should do the testing in a broader way, because the family doctors, they do have the HIV kits in their cabinets, and it is also possible to involve more the family doctors, because any family doctors, according to the National Medical Insurance Company, once a year will report about every person recorded in his list, and every person should do some prophylactic tests like glucose test, diabetes mellitus test, insulin test, or things like that. We could include the HIV testing there as well. And we should get rid of this discrimination thing, because nobody discriminated anyone. We don't judge anyone. We want everyone to be in a good health. Thank you.
I think he's from Moldova part, so this side is going to answer.
Thank you so much for your thoughts, for your opinion, because in the end, we all together want to reveal the HIV infection as early as possible with less consequences for the health and life of any person. The problem, unfortunately, relates to the teenagers, to the adolescents. And here we don't speak about discrimination, but we speak about limited access. Because if a mother works abroad, for example, and there is no caregiver present, the adolescent could not ask for the service. Or if, for example, the teenager has a not very trustful relation or not very open relation with their parents, they will not inform their parents that they would like to do an HIV test. But I completely agree with you. The broader the testing is done, the more usual will it become. And we hope. But besides the testing, as we saw in all the previous research, besides the testing, we should have some other things, because we saw that there is a little bit of discrimination in all the institutions. I would like to add here, of course, it would be very simple, apparently simple from the system. We align everyone in a row, as many countries do. Once a year or twice a year, they do a pregnancy test for the girls who go to school, and if they are pregnant, they are kicked out from the school. A good, interesting method of preventing pregnancy. So I don't want to go to extremes, of course, because the testing involves, especially among adolescents, mandatory HIV testing is also a counseling tool, because without counseling, if we, for example, have good counseling testing, we consider that we will convince a teenager. We didn't have cases when a teenager would refuse if we saw that there are indications, but counseling is mandatory. There are two different things. So we have a need to do a testing for one person. We could, for example, take the person by the hand and say, you must do this, otherwise I don't give a certificate. And there is another thing we could do. We could take this person by the hand and propose, let's speak about your risk, let's talk about your risk. Let's evaluate your risk and see what your needs are and propose the testing. And I support you, of course, if we have more possibilities to offer these test in sort of vending machines. It would be very good. Another moment about the teenagers and key population. We noticed a very interesting phenomenon, especially among the older adolescents. They consider, especially if they read a lot, they consider that HIV takes place only among several populations, and this doesn't relate to them. And they say, well, let's those vulnerable groups take care of this. This is the feedback of youth, actually. You have these vulnerable groups in your program, they should be protected. And we don't have this. We are like good adolescents, very clever and intelligent. But we, in our services, we want to cover all the adolescents, independently whether they have risky behavior. But it's good to share this knowledge with everyone. Because paradoxical situation happens, and I don't refer. They say, the adolescents say, I am not in the vulnerable group, so this doesn't refer to me. So, and in this way, the risk is higher for these intelligent teenagers.
I'd like to add a few things. We must understand that prevention for young people must be attractive. And I forgot to tell you about another product of ours. You basically have to make it look like a candy that will be attractive. We have party boxes. This is not HIV testing. This is something that will help you have a good party. And there we put condoms, lubricants, and HIV tests, plus additional materials to reduce harm from psychoactive substances. And everyone wants this party box and share this. You can get a party box online. We have online outreach. We place a test, and if you do the test, you get a party box. The test is actually 60 questions, but the adolescents answer all these questions, and then they get a unique code because the survey is anonymous. And then we send by mail this party box. The child doesn't need to go anywhere, neither to a medical institution, nor to some other place. And there is this HIV test. So if you're interested, we are ready to share more information about this outreach initiative.
About stigma. We can create service. It can be perfect. It can be attractive, but nobody can use it because of anticipated stigma. Because people think that they cannot use this because it's shameful. Because HIV is something that is not about them. Because HIV is about, this key population, and this never touches their lives. So this is how stigma operates in this population. We need to increase the awareness about, about HIV infection, what it is, what a risk for that, and how to protect themselves. You know that if you get tested and no result, you can live, you can get treated, and you can live a fruitful, long life. That's why, in addition to providing good quality service, we need to create a demand for this service. People have to be confident that they can use this service and everything will be good even if they are HIV positive. Because now life is different. It's not like 20, 30 years ago when HIV was like a death sentence. So that's why we have to create these programs to increase awareness, to disrupt this link between lack of awareness, stigmatizing attitude, and formulation of stigma and low uptake of HIV services. That's why we need to work on that. Thank you.